we are in control. Everybody needs to engage in some type of exercise program. The other thing that impacts greatly on our overall health is our diet, and so we spend a lot of time talking about eating more fruits and vegetables, less saturated fats, less refined sugar. The one thing that's different about family history compared to other risk factors is you can't control it. You can control your tobacco use and your exercise and your diet, and you can control your cholesterol and blood sugars to some degree, but you can't pick your parents. And so it's very important that we look at that part of it in terms of heart disease, risk for diabetes, certain cancers like prostate cancer and colon cancer. So it becomes a huge factor in terms of the things that we can control. Remember, they're only numbers. And what's most important is what you do on a daily basis. How much exercise are you getting per week, and how often are you exercising? Are you eating a low-fat diet? Are you eating more fruits and vegetables? Are you watching your sugars? And numbers are just a reflection of how you're doing. They're a report card, if you want to think of it that way. I don't treat numbers, I treat patients. So I tend to focus more on what are you doing today to make yourself healthier. You have to identify what your cause of stress is. If it's your job or family or money, you have to work on that. And then we have to practice what I call thought stopping. We worry, we perseverate about certain things. We just need to focus on what we can control. The other thing I tell people is we need to eat healthy. That helps us control stress. We need to exercise on a regular basis because that helps us control stress. And one thing I haven't mentioned yet is we need to get a good night's sleep. Stress is always magnified many times if we're not rested and getting a good night's sleep. We can make a huge impact on the outcomes in our health. Heart disease, cancers, strokes, those are the big three killers in our society. And some of these are inevitable, but you can shift the odds into your favor. And it's not with medications, it's what we can do to lower our risk of getting those types of things.